Eat weight disorder. 2024 June 8, 29, 142. DOI 10.1007/S40519-024-01669-1. Abstract. Purpose: the Eating Attitude Test, 26, EAT 26, is a screening tool for eating disorders, EDs, in clinical and non-clinical samples. The cutoff score was suggested to be varied according to target population. However, no studies have examined the appropriateness of the originally proposed score of 20 for screening DSM-5 eating disorders in Japan. This study aimed to identify an appropriate cutoff score to better differentiate clinical and non-clinical samples in Japan for EDs. Methods: the participants consisted of 54 patients with anorexia nervosa restricting type, 58 patients with anorexia nervosa binge eating/purging type, 37 patients with bulimia nervosa diagnosed according to DSM-5 criteria, and 190 healthy controls, HCs. Welch's t-test was used to assess differences in age, body mass index, BMI, and total EAT 26 scores between HCs and patients with EDs, receiver operating characteristic, ROC. Analysis was conducted to identify the optimal cutoff score. Results: the HCs had significantly higher BMI and lower total EAT 26 mean scores than patients with EDs. The area under the ROC curve was 0.925, indicating that EAT 26 had excellent performance in discriminating patients with EDs from HCs. An optimal cutoff score of 17 was identified, with sensitivity and specificity values of 0.866 and 0.868, respectively. Conclusions: the result supports the suggestions that optimal cutoff score should be different according to target populations. The newly identified cutoff score of 17 would enable the identification of patients with EDs who have been previously classified as non-clinical samples in the EAT 26 test. Level of evidence. 3. Evidence obtained from case control analytic study. PMID 3885039DI 10.1007/S40519-024-01669-1. Eat weight disorder. 2024 June 8, 29, 140. DOI 10.1007/S40519-024-01670-8. Abstract. Purpose: high levels of physical activity have been documented in eating disorder patients. Our aim was to examine whether adolescent leisure time physical activity is prospectively associated with eating disorders in adolescence and young adulthood. Methods: Finnish twins born in 1983 to 1987 reported their physical activity frequency at ages 12, 14, and 17. A subsample of participants underwent structured, retrospective interviews for eating disorders at the mean age of 22.4 years. Associations between female twins' physical activity and future eating disorders: 571 to 683 twins/WAVE were investigated with the Cox proportional hazards model. To illustrate the physical activity similarity of the co-twins in a twin pair, we used cross-tabulation of eating disorder discordant twin pairs, 13 to 24 pairs/WAVE. Results: after adjusting for several covariates, we found no statistically significant longitudinal association between physical activity and eating disorders. This applied when all eating disorders were combined, but also when assessed separately as restrictive and non-restrictive eating disorders. Co-twins' physical activity in adolescence tended to be similar irrespective of their future eating disorder, supporting the results of the regression analysis. Conclusion: we observed no evidence of adolescent physical activity frequency being prospectively associated with eating disorders in female twins. Further longitudinal studies with larger sample sizes and more detailed physical activity data are needed. Level of evidence. 3. Evidence obtained from cohort or case control analytic studies. PMID 388503370I 10.1007/S40519-024-01670-8. Document the CPD share evidence. Estimated reading time, 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Adolescent leisure time physical activity and eating disorders, a longitudinal population-based twin study. Title: VR-related evidence matrix. Exercise identity and physical activity behavior during late adolescence, a 4-wave cross-lagged panel model. Comparison between physical activity and stress-related lifestyle between orthorexic and non-orthorexic university students, a case control study. Comparison between physical activity and stress-related lifestyle between orthorexic and non-orthorexic university students, a case control study. Personality and motivation of physical activity in adolescent girls, effects of perceived parental support and social physical anxiety. Perimenopausal physical activity and dementia risk, a systematic review. Comparison between physical activity and stress-related lifestyle between orthorexic and non-orthorexic university students, a case control study. Longitudinal description and prediction of physical inactivity among patients with borderline personality disorder and personality disordered comparison subjects. Longitudinal description and prediction of physical inactivity among patients with borderline personality disorder and personality disordered comparison subjects. Determinants of weight status and body, health and life satisfaction in young adults. Course of avoidant/restrictive food intake disorder, emergence of overvaluation of shape/weight. Assessing the Mole Psychiatry, 2024 June 7th. DOI 10.1038/S41380-024-02601, W. Online ahead of print. Abstract. Anorexia nervosa, AN, is a complex metabolic and psychological disorder that is influenced by both heritable genetic components and environmental factors. Exposure to various environmental influences can lead to epigenetically induced changes in gene expression. Epigenetic research is still in its infancy, and studies to date are limited in determining clear, valid links to disease onset and progression are limited. Therefore, the aim of this systematic review was to compile and critically evaluate the available results of epigenetic studies specifically in and to provide recommendations for future studies. In accordance with the PRISMA guidelines, a systematic literature search was performed in 3 different databases, PubMed, Embase, and Web of Science, through May 2023. 23 original papers or conference abstracts on epigenetic studies in and were collected. Epigenome-wide association studies, EVASAs, which analyze DNA methylation across the genome in patients with N and identify potential disease-relevant changes in promoter/regulatory regions of genes, are the most promising for future research. To date, 5 EVASAs on and have been published, suggesting a potential reversibility of malnutrition-induced epigenetic changes once patients recover. Hence, determining differential DNA methylation levels could serve as a biomarker for disease status or early diagnosis and might be involved in disease progression or chronification. For future research, EVASAs with a larger sample size, longitudinal study design, and uniform methods should be performed to contribute to the understanding of the pathophysiology of AN, the development of individual interventions, and a better prognosis for affected patients. PMID 388495160I 10.1038/S41380-024-02601 W. Document the CPD share evidence. Estimated reading time 5 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Epigenetic alterations in patients with anorexia nervosa systematic review. Title: VR-related evidence matrix. iPSC-derived models for anorexia nervosa research. Association of serotonin receptor gene polymorphisms with anorexia nervosa, a systematic review and meta-analysis. Gestational epigenetic age and ADHD symptoms in childhood, a prospective, multi-cohort study. Epigenetic modifications of DNA and RNA in Alzheimer's disease. Epigenetic mechanisms linking early life adversities and mental health. Exploring the epigenetic landscape, the role of 5-hydroxymethylcytosine in neurodevelopmental disorders. Exploring the influence of stress on aggressive behavior and sexual function, role of neuromodulator pathways and epigenetics. Factors predicting long-term weight maintenance in anorexia nervosa, a systematic review. Energy expenditure during nutritional rehabilitation, a scoping review to investigate hypermetabolism in individuals with anorexia nervosa. Group cognitive remediation therapy for adolescents with anorexia nervosa, outcomes before, after, and during follow-up in a real-world setting in Japan. June 8, 2024. Evidence. Clin Child Psychiatry. 2024 June 7:135904524125925. DOI 10.1177/13591045241259255. Online ahead of print. Abstract. Objective, cognitive remediation therapy, CRT, can be used as an adjunct treatment for adolescents with severe and complex anorexia nervosa and requiring inpatient treatment. However, there has been only one study on CRT for adolescents with and in Japan. This study explored group CRT as an adjunct to inpatient treatment for Japanese adolescents with severe and complex and requiring inpatient care. Methods: 31 adolescents with and underwent group CRT. Neuropsychological, set shifting and central coherence, and psychological assessments, motivation, self-esteem, and depressive symptoms were measured before and after the intervention. Weight and symptoms were measured before and after the intervention and at follow-up, and the adolescents completed post-intervention and follow-up questionnaires. Results: set shifting led to medium to large effect size improvements. Medium effect size improvements in central coherence and depressive symptoms were also observed. The feedback from the adolescents was mainly positive, and the treatment completion rate was high. The patients also reported that the skills learned through group CRT could be applied in daily life. Conclusion: group CRT may be beneficial for adolescents with severe and complex and who require inpatient care. PMID 3884936 doi 10.1177/13591045241259255. Document the CPD share evidence. Estimated reading time: 4 minutes. Latest: psychiatryai.com #Razor4D. Cool evidence: engaging young people and students in real-world evidence. Real-time evidence search: psychiatry. AI research. Group cognitive remediation therapy for adolescents with anorexia nervosa, outcomes before, after, and during follow-up in a real-world setting in Japan. Title: VR-related evidence matrix. Intensive cognitive behavioral therapy for adolescents with anorexia nervosa, outcomes before, during, and after the COVID-19 crisis. Examining the impact of a group treatment using cognitive and social cognition remediation for young offenders, the Justice Health NSW School Link Advantage pilot study. Enhancing emotional abilities in anorexia nervosa treatment, a rolling group cognitive remediation and emotional skills training protocol. Illness duration and treatment outcome of intensive cognitive behavioral therapy in adolescents with anorexia nervosa. Inpatient treatments for adults with anorexia nervosa, a systematic review of literature. Inpatient treatments for adults with anorexia nervosa, a systematic review of literature. Prevalence and determinants and risk factors for renal damage. Where do patients hospitalized for severe anorexia nervosa stand? A multi-center study. June 6, 2024. Evidence. Eat disorder. 2024 June 5, 12, 172. doi 10.1186/S40337-024-01024W. Abstract. Background. Although renal damage is increasingly reported among the most undernourished patients with anorexia nervosa, and it remains underestimated in current practice and often associated with acute dehydration. The purpose of our study was to evaluate the frequency, the extent, and the risk factors of renal involvement among adolescents and adults hospitalized in specialized units for N. Methods. In this multi-center study, 197 consecutive participants were included, aged 13 to 65, from 11 inpatient eating disorder psychiatric units. Information on the course of AN, clinical characteristics, biological data, and medication were collected. Results. At admission, mean BMI was 13.1, plus or minus 1.6 kg/m2 for a mean age of 20.74, plus or minus 6.5 years, and the Z-score was 3.6, plus or minus 1.33. 6 participants, 3%, had hyponatremia, 4, 2%, had hypokalemia, and 9, 4.5%, had hypochloremia. The blood urea nitrogen/creatinine ratio was over 20 for 21, 10.6% participants. The mean plasma creatinine was 65.22, plus or minus 12.8 mol/L, and the mean eGFR was 74.74, plus or minus 18.9 ml/min 30. 5 participants, 17.8%, had an eGFR greater than 90 milliliters per minute, 123, 62.4%, from 60 to 90 milliliters per minute, 35, 17.8%, from 45 to 60 milliliters per minute, and 4, 2%, under 45 milliliters per minute. In multivariate analysis, only BMI on admission was a determinant of renal impairment. The lower the BMI, the more severe was the renal impairment. Conclusion: when eGFR is calculated, it highlights renal dysfunction found in severe and requiring hospitalization in specialized units. The severity of undernutrition is an independent associated factor. Kidney functionality tests using eGFR, in addition to creatinine alone, should be part of routine care for patients with and to detect underlying renal dysfunction. PMID 3884017 10.1186/S40337-024-01024 W. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Determinants and risk factors for renal damage. Where do patients hospitalized for severe anorexia nervosa stand? A multi-center study. Title: Enhancing Emotional Abilities in Anorexia Nervosa Treatment, a Rolling Group Cognitive Remediation and Emotional Skills Training Protocol. June 6, 2024. Evidence. Your Eat Disordered Rev 2024 June 4. doi 10.1002/of.3113. Online ahead of print. Abstract. Introduction. Anorexia nervosa, AN, is characterized by limited remission rates and emotional dimensions are often neglected. Cognitive Remediation and Emotional Skills Training, CREST, protocol aims to address cognitive and emotional factors. This study evaluates the feasibility and effectiveness of a modified rolling group CREST protocol in an inpatient setting. Methods. Quasi-experimental design evaluated CREST protocol in a rehabilitation program. A total of 116 females diagnosed with AN were included, of whom 63 were included in the CREST protocol and 53 in the standard rehabilitation treatment. Various standardized measures were employed to assess psychopathology. Data collection occurred longitudinally before and after CREST implementation. Results: no significant differences emerged between groups regarding changes in specific eating psychopathology. CREST group exhibited significant improvements in emotion regulation, p equals 0.002, and social skills, p equals 0.014, besides a reduction in alexithymia, p less than 0.001, and cognitive rigidity, p equals 0.013. Empathic features remain stable. Participants reported positive perceptions of the CREST intervention. Discussion: the study highlights the potential benefits of integrating emotional training within multidisciplinary intensive treatment for N. Results emphasize the importance of treatment protocol with more effective and hot cognition-related interventions beyond weight-related psychopathology. Implementing a rolling group CREST protocol in an inpatient setting showed promise in enhancing the emotional abilities of end patients. PMID 388375559 DOI 10.1002/.3113. Document the CPD share evidence. Estimated reading time 4 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence on real-time evidence search, psychiatry. AI research. Enhancing emotional abilities in anorexia nervosa treatment, a rolling group cognitive remediation and emotional skills training protocol. Title: VR-related evidence matrix. Correction to comparing randomized controlled trials of outpatient family-based or inpatient multimodal treatment followed by outpatient care in youth with anorexia nervosa, differences in populations, metrics, and outcomes. Treatment of patients with anorexia nervosa and comorbid post-traumatic stress disorder. Where do we stand? A systematic scoping review. Seeing oneself as an unattractive loser, similar interpretation and memory biases in adolescents with anorexia nervosa and adolescents with depression or anxiety. Body shape rather than facial emotion of others alters interpersonal distance in patients with anorexia nervosa. A prospective observational study Front Cycle, 2024 May 17, 15:1408695. doi 10.3389/FPSYG.2024.1408695. E-Collection 2024. Abstract. Introduction. Evidence on parental educational level, PL, as a risk factor for eating disorders, EDs, is mixed, and no study has assessed its role in relation to the compliance and outcomes of treatments in EDs. Further, no study differentiated from the educational level of mothers and fathers, nor considered the possible mediation of perfectionism in fostering EDs. Methods. A clinical sample of 242 first-ever admitted inpatients with EDs provided information on PL and completed the following questionnaires: the Eating Disorder Examination Questionnaire, EDQ, and the Frost Multidimensional Perfectionism Scale, FMVS. Clinicians also provided information on the Hamilton Rating Scale for Anxiety, HAM-A, and the Hamilton Rating Scale for Depression, HAM-D, for each participant. Results. Individuals with high PL, whether mothers, fathers, or both parents, showed significantly higher scores on depressive symptoms and lower on parental criticism, were younger, had an earlier age of onset, had fewer years of illness. More were students and employed, and fewer had offspring. Individuals with fathers or both parents with high educational levels suffered more from anorexia nervosa rather than bulimia nervosa, had a longer length of stay during the current hospitalization, had less dietary restraint, and had higher personal standards. Individuals with mothers with high educational levels showed a lower rate of previous substance or alcohol addiction. Personal standards partially mediated the relationship between higher PL and lower dietary restraint. Discussion. PL emerged to be a twofold psychosocial risk factor, being associated with higher depressive symptoms and a longer length of stay, but also with a shorter duration of illness and better scholar and working involvement. Higher PL was related to higher personal standards, but not to global perfectionism. Patterns of eating psychopathology emerged based on the high PL of mothers or fathers. PMID 38827891 PMC, PMC 111401360OI, 10.3389/FPSYG.2024.1408695. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Role of parental educational level as psychosocial factor in a sample of inpatients with anorexia nervosa and bulimia nervosa. Title. VR-related evidence matrix. Established and emerging treatments for eating disorders. Attachment, mentalization, emotion dysregulation, and empathy in eating disorders, comparing anorexic and bulimic patients. Attachment, mentalization, emotion dysregulation, and empathy in eating disorders, comparing anorexic and bulimic patients. Prevalence of eating disorders and comorbidity with depression among adolescents in Saudi Arabia, a cross-sectional study. Orthorexic tendency and its association with weight control methods and dietary variety in Polish adults, a cross-sectional study. Orthorexic tendency and its association with weight control methods and dietary variety in Polish adults, a cross-sectional study. Dietary intake of adults with eating disorders, a systematic review and meta-analysis. Prevalence of suicide attempt, suicide ideation, and self-harm at diagnosis in adolescents with eating disorders. Suicidal thoughts and attempts in a transdiagnostic eating disorder sample. Do diagnostic severity criteria predict risk? Neurobiological, genetic, and epigenetic foundations of eating disorders in youth. Association between type 1 diabetes mellitus and eating disorders, a systematic review and meta-analysis. Self-compassion promotes positive mental health in women with anorexia nervosa, a 2-week daily diary study. A parental burnout modeling based on perfectionism mediated through self-compassion in parents of